Most Nigerians have no idea how expensive pregnancy and childbirth can be until the bills start coming in. Today I'm going to break down the real cost of having a baby in Nigeria. From antenatal care to scans to delivery to newborn essentials. No sugarcoating, no exaggeration, just the real numbers you should expect in 2026. My name is Dr. Abah, and I help you live healthier, wealthier, and smarter. If that sounds good to you, please hit the subscribe button so you don't miss my weekly videos. Let's start from the beginning. Antenatal care. So, when a woman gets pregnant, the first major cost is antenatal registration. Now, this varies widely depending on where you go. In most public hospitals, registration and early visit usually cost between 10,000 to 40,000 naira. In private hospitals, you can expect about 50,000 to 150,000 or even more depending on the facility. So this usually covers your booking, routine visits, and basic medications like folic acid, iron, and some hospitals include some others. So always ask exactly what the package covers. Next is investigations, and this include scans and laboratory tests. Throughout pregnancy, you need an early ultrasound scan. You need an anomaly scan, which is usually done around 20 weeks. And then you need routine blood tests, urine tests, glucose tests, sometimes extra scans depending on the pregnancy. So in total, across the entire pregnancy, the cost of investigation usually falls between 30,000 to 150,000 depending on whether you use a public or a private facility. Scans are very, very important because they help detect problems early and prevent expensive emergencies later. Now, let's talk about the big one, which is the delivery cost. And again, this depends on the hospital and type of delivery. So the normal delivery, which we call this spontaneous vaginal delivery, in public hospitals, it's between 30,000 to 80,000. While in private hospitals, you could expect to pay as much as 150,000 to 500,000 depending on the facility. While in very high-end private facility, you can pay above that, even up to 1 million. For cesarean section in public hospitals, you can look at 80,000 to 200,000, while in private hospitals, it's between 300,000 to about 1 million and above. And in high-end private facilities, my dear, you can pay up to 2 million or more in some places. So CS is more expensive because it requires a full surgical team, theater use, drugs, longer hospital stay. But remember, the goal isn't to avoid CS. The goal is to deliver safely, whichever method is medically best for the mother and baby. So now, let's talk about what you need for the baby. And this includes baby clothes, diapers, baby bed or cot, baby bath set, delivery bag items, towels, breast pump, formula if necessary, and even more. Most families spend between 100 and 350k on newborn items, depending on their budget and preferences. So immunizations are free, especially in government-owned facilities, which help to reduce costs. Now, there are some hidden costs that many people don't think about. Something like extra medications, emergency blood, additional hospital stay, baby needing oxygen or even phototherapy, and sometimes there are unexpected tests as well. Then ambulance services, consumables. So these things happen to These things don't really happen to everyone, but when they do, they can increase the cost significantly. This is why it's important to have some money set aside, even when your pregnancy is going smoothly. So let me summarize everything into this very simple estimate. So in public hospital for normal pregnancy, expect between 100 to 250,000. In private hospital for normal pregnancy, you can expect between 300 to 900,000. If CS is involved, between 500 and 2 million. And again, these numbers vary, but they give you a realistic idea of what to expect in Nigeria today. Here are some ways to reduce the cost without risking your health. Register early for antenatal, attend clinic regularly, choose a hospital that matches your budget and competence, buy newborn items gradually, ask for price list early, enroll in health insurance if available, avoid self-medications. Complications are more expensive than prevention. Most emergencies that come that cost millions can be prevented by proper antenatal care. And I hope this breakdown helps you plan better. If you found this video helpful, please hit the like button, subscribe, and share it with someone who's expecting or planning to expect. Tell me in the comments, how much did your delivery or antenatal care cost? Your experience can help someone else. Thank you so much for watching. I'm Dr. Abah. Stay healthy, stay wealthy, and stay smart.